Abnormal masses verified by barium enema. Tumor detected by CT scan. Elevated carcinoembryonic antigen test, and a liver scan showing possible metastasis. What are the nursing diagnoses for clients who have colorectal cancer? Constipation related to altered bowel elimination patterns. Diarrhea related to altered bowel elimination patterns. Anxiety related to the diagnosis of cancer. Pain related to difficulty with bowel elimination because of partial or complete obstruction of the colon by the tumor. Fear related to the potential for metastasis and death. Ineffective individual coping related to ostomy surgery and side effects of treatment. Anticipatory grieving related to the cancer diagnosis and stage of disease if advanced. And body image disturbance related to surgery and the creation of a colostomy. It is essential to screen clients for colorectal cancer and to initiate treatment as early as possible. The American Cancer Society recommends that everyone over 50 years old have an annual digital rectal examination and fecal testing for occult blood. All clients over 50 should undergo a flexible sigmoidoscopy every 5 years. All clients should be instructed to eat a low-fat diet and report changes in bowel habits. The long-term use of aspirin or NSAIDs may also help to reduce the risk of colorectal cancer. Clients at risk for colorectal cancer should undergo diagnostic tests before the age of 50 and at frequent intervals as determined by the primary care provider. If colorectal cancer is diagnosed, the goals of management include removing the malignant tumor, administering radiation or chemotherapy, providing emotional support, establishing a bowel program, teaching the client self-care following the surgery, and preventing complications such as anemia, infection, peritonitis, and postoperative complications. Surgical procedures for removing the tumor depend on the site and the extent of the cancer. Hemicolectomy involves resection of the tumor and regional lymph nodes. A colon resection involves removal of the bowel segment that contains the tumor. Several inches of tissue extending beyond the tumor are also resected. The client might have a temporary or a permanent colostomy. An abdominal perineal or AP resection involves removal of the entire rectum and supporting structures, closure of the anus, and formation of a permanent colostomy. Next, we will discuss the preoperative, postoperative, and long-term care of a client undergoing ostomy surgery. Colostomy, ileostomy. An ostomy is a surgical opening made through the abdomen into the colon or the ileum for the excretion of wastes. Ostomies can be temporary or permanent. The location of the ostomy within the intestine determines the consistency of the excreted stool. The stool is excreted through a stoma, which is an artificial opening on the exterior surface of the abdomen. What are the indications for ostomy surgery? Small bowel obstruction, large bowel obstruction, colon cancer, inflammatory bowel disease due to ulcerative colitis or regional enteritis, abdominal trauma, and compromised blood supply to the intestine. Diagnostic tests performed prior to ostomy surgery include flat and upright abdominal X-rays, colonoscopy, MRI, CT scan, and ultrasound. The client may undergo a barium enema, provided bowel obstruction is not suspected. The goals of ostomy surgery are to relieve the obstruction, reduce inflammation, remove the tumor, restore bowel function, and prevent complications such as stoma necrosis, peritonitis, and infection. During colostomy surgery, the surgeon makes an incision in the abdominal wall and pulls a loop of the colon, or the severed end of the colon, through the incision, where it is shaped into an artificial opening called a stoma. A colostomy allows feces to be expelled into a colostomy bag or pouch attached to the skin around the stoma. A permanent colostomy involves the removal of the rectum, anus, or distal portion of the bowel. A colostomy is temporary when the rectum and the anus are left intact, and reanastomosis is possible. During ileostomy surgery, the surgeon removes the colon and the rectum, and then pulls the ileum, which is the lower part of the small intestine, through an incision made in the abdominal wall. An artificial outlet is created to allow the bowel to expel feces through the stoma into a bag attached to the skin. As a rule, the stoma is placed on the client's right side, around 2 inches, that's 5 centimeters, below the waist and away from the hip bone. An ileostomy is usually permanent. What are the nursing diagnoses for clients undergoing ostomy surgery? Body image disturbance related to the presence of the stoma and odor. Grief related to loss of control of body elimination. Pain related to the surgical incision. Risk for impaired skin integrity related to chemical irritation from bowel contents or improper fitting of the pouch. Risk for diarrhea related to interruption or alteration of normal bowel function. Risk for constipation related to interruption or alteration of normal bowel function. Altered nutrition, less than body requirements, related to decreased appetite and inability to tolerate some foods. Risk for deficient fluid volume related to diarrhea. Impaired social interaction related to fear of embarrassment caused by altered bowel control and/or odor. And sexual dysfunction related to altered body structure, function, and image. Here are a few questions about clients who have had an ileostomy or colostomy. Which client is required to wear a bag or an ostomy appliance? The client with an ileostomy, because it's higher up in the bowel and therefore there is continuous leakage of liquid. Some colostomy clients do not need to wear a bag once they've learned to irrigate the bowel and have a bowel movement once a day. Which client is at greatest risk for fluid and electrolyte imbalance? The client with the ileostomy, because it's in the small intestine. Which client can swim or take a bath? The client with the colostomy. There's too great a risk of infection for the ileostomy client. There is also a chance that a client wearing an ostomy bag could infect the pool. Which client